Hi friends, this is Dr. Shri. I welcome you all to my channel on Cardiac Essentials. So we have been talking about coronary heart disease and how do we prevent it and what is causing it. So the main thing everyone has to keep in view is the diet. Today we'll be talking about the keyhole heart surgery. So when we talk about keyhole surgery, we all know, like as I was discussing in my previous video, it is a minimally invasive surgery that is performed using small 3 to 4 inch incisions between the ribs rather than cracking the breastbone. So usually specialized instruments like cameras, robots, they repair and replace heart walls and do like bypass arteries and treat atrial fibrillation, which results in less pain, lower infection risk, and quicker recovery. So now you might be asking, Dr. Shri, what are the main things that we do with a keyhole surgery related to heart? So as a keyhole surgeon, I would say that the main thing one can do is repair and replace the aortic, mitral or tricuspid walls, which is done through small cuts on the right side of the heart. And then the other part of it is even CABG, coronary artery bypass grafting, CABG, They perform bypass surgeries, single or multiple, through small incisions between the ribs, comparatively to the traditional method of like open heart surgery. The other advantage is helping treat heart rhythm ablation, so treating atrial fibrillation. So by creating scar tissue to disrupt abnormal electrical pathways. The other advantage is also you can do a keyhole surgery in structural repairs. It can be like closing holes in the heart. For example, the septal defects, and also helps in removing tumors. And the next thing what we can talk is the robotic assisted surgery. So what happens is here the surgeons utilize advanced high definition 3D camera systems for enhanced precision during complex repairs. So like I said, when you are talking about a keyhole surgery, laparoscopic surgery, it's a minimal invasive surgery. And why do we have to talk about it over the traditional open heart surgery? Here the incisions are smaller. The main thing is faster healing. So no bone breakage, allows healing in 6 to 7 days compared to 12 weeks for traditional methods. And the post-op reduced complications are really lower. So lower risk of infection and significantly less bleeding. And on the cosmetic side too, it gives like very good results, like smaller hidden scars rather than a full midline chest scar. And recovering phase is also quicker. Many patients can return to daily routines in 3 to 4 weeks. So it has many advantages comparatively with the traditional methodology. So common approaches typically used for wall procedures like aortic and mitral wall. And on the left side, often used for bypassing heart arteries. So while these procedures are technically demanding, they are very much safe compared to traditional surgery when performed by specialized teams. So when you are talking about a keyhole heart surgery, So they have their own advantages than the traditional method. So, like I said, the hospital, what could be the hospital time will also be less. The recovery time is faster. So there are several benefits to choosing keyhole heart surgery over traditional open heart surgery. So one of the most significant benefit is quicker healing, like we were talking before. It just takes like few weeks rather than several months. And patients who undergo keyhole heart surgery also report less pain and discomfort with those on the open heart surgery. And with the smaller incisions, bleeding is less, and it reduces the need for blood transfusions during and after the surgery. So another big benefit factor of keyhole heart surgery is a lower risk of serious bone infection, which many a times happens. The breastbone incision used in traditional open heart surgery can, increase the risk of sternal wound infection, so which can be really life-threatening complication. Whereas in keyhole heart surgery, with smaller incisions, the risk of infection is very less, making it a very safer option for many patients. And also when you are talking about the cosmetic part of it, like I discussed before, the smaller scars from the incisions also result in a more aesthetically pleasing outcome, which is very important for the patients. Now, keyhole heart surgery is generally used to perform various heart procedures, including valve replacement or repair, or CABG, coronary artery bypass grafting, or aortic root replacement. So when we are talking about a valve replacement or a repair, this is a common procedure performed using keyhole heart surgery. But again, like I said in my previous videos, there are factors to determine whether the patient is a ideal candidate for the keyhole heart surgery. So many factors are there. If they don't meet the requirements, then surgeons have to go by the traditional open heart surgery. But when you are talking about the benefits are more with the keyhole heart surgery. The surgeon can access the heart through small incisions and use specialized instruments to repair or replace the damaged heart walls. So this can help improve blood flow, and patients are relieved and relieve symptoms such as chest pain, shortness of breath, and fatigue in patients. Now when you are talking about a coronary artery bypass grafting, this is another CABG, is another procedure that can be performed using keyhole heart surgery. So here the surgeon can use, again like I said before, specialized instruments to access the blocked or narrowed coronary arteries to create new pathways for blood flow. That improves the blood flow to the heart and relieves symptoms such as chest pain and shortness of breath. The other factor is aortic root replacement. So aortic root replacement is a procedure, wherein what happens is, wherein replacing the aortic valve and the root of the aorta takes place, which is the largest artery in the human body. This can be performed using keyhole heart surgery. So again, it is an invasive approach with a faster recovery time. So advantages are more with less bleeding, faster recovery time, and less stay in the hospital. So when we are talking about a keyhole heart surgery, it is crucial to find an experienced surgical team, who have performed this type of surgery many times before. That is one of the very important stuff, because experienced teams have the knowledge, skill and expertise needed to ensure that the procedure is performed safely and effectively. For any doctors, patient's safety comes first. Patient's comfort and patient's safety is the important, comes first than anything. So what happens is when it is handled by highly experienced, effective team, safety is more. It reduces the risk of complications, improves the outcomes for patients. So one of the most significant advantage of choosing an experienced keyhole heart surgery team is they have the ability to handle any potential complications which might be arising during the procedure. And despite the minimally invasive nature of the keyhole heart surgery, there are still many more risks involving bleeding, infection, blood clots, heart attack, stroke, damage to surrounding organs. So it is always a good practice to go with a experienced or knowledgeable, teams, keyhole surgical teams. So, and second thing, you have to ensure that the hospital is well equipped and managed any low to high complications. Like we were discussing before, so despite the minimally invasive nature of the keyhole heart surgery, there is still a risk of bleeding, infection, blood clots, heart attack, stroke, and damage to surrounding organs. So it is always a good practice to go by an experienced and efficient team and a hospital that is highly equipped to identify and manage low to high complications. So that is highly beneficial in reducing the risk of serious complications that could impact the patient's overall health and well-being. So there might be another advantage too. So in keyhole heart surgery team, to customize the procedure to the patient's specific needs. So we'll be discussing about this more in the upcoming videos. So if you like my video, please do subscribe and stay tuned, so that you will have information beforehand and or have medical awareness. With this, I'm going to end my video. Wishing you all a long and healthy life. Thank you and God bless.